You have cancer. Miss Baring, you have advanced metastatic ovarian cancer.
Go on.
You are a professor, Miss Baring.
Like yourself, Dr. Kalikian.
Ah, yes. Now then, you present with a growth that unfortunately went undetected in stages 1, 2, and 3. Now it is an insidious adenocarcinoma.
Insidious?
Insidious means undetectable at an early stage.
Insidious means treacherous.
Shall I continue?
Oh, by all means.
Good. In invasive epithelial carcinoma, the most effective treatment modality is a chemotherapeutic agent. We are developing an experimental combination of drugs designed for primary site ovarian with a target specificity of stage 3 and beyond administration. Am I going too fast?
No.
Good. You will be hospitalized as an inpatient for treatment each cycle. After the initial 8 cycles, you will have another battery of tests. The antineoplastic will inevitably affect some healthy cells, including those lining the gastrointestinal tract from the lips to the anus and the hair follicles. We will, of course, be relying on your resolve to withstand some of the more pernicious side effects. Miss Baring?
Oh, I beg your pardon.
Do you have any questions so far?
Please go on.
Perhaps some of these terms are new?
No. You're being very thorough.
I make a point of it, and I always emphasize it with my students. Where were we, Dr. Perry?
I believe I was being thoroughly diagnosed.
Right. Now, the tumor is spreading very quickly, and this treatment is very aggressive. So far, so good?
Yes.
Better not teach next semester.
Out of the question.
The first week of each cycle, you'll be hospitalized for chemotherapy. The next week, you may feel a little tired. The next 2 weeks will be fine, relatively.
8 months like that.
This treatment is the strongest thing we have to offer you. And as research, it'll make a significant contribution to our knowledge.
Knowledge. Yes.
Here is the informed consent form. Should you agree, you sign there at the bottom. Is there a family member you want me to explain this to?
Oh, that won't be necessary.
Good. The important thing is for you to take the full dose of chemotherapy. There may be times when you wish for a lesser dose due to the side effects, but we've got to go full force. Dr. Baring?
Yes.
You must be very tough. Do you think you could be very tough?
You needn't worry.
Good. Excellent.
I should have asked more questions, because I knew there was going to be a test. Hi, how are you feeling today?
Fine.
Great. That's just great. This is not my standard greeting, I assure you. I tend towards something a little more formal, a little less inquisitive. Such as, say, hello. But it is the standard greeting here, so I just say fine. Of course, it is not very often that I do feel fine. I have been asked, how are you feeling today, while I was throwing up into a plastic wash basin. I have been asked, as I was emerging from a 4-hour operation with a tube in every orifice, how are you feeling today? I'm waiting for the moment when someone asks me this question and I am dead. I'm a little sorry I'll miss that. I have cancer. Insidious cancer with pernicious side effects. No, the treatment has pernicious side effects. I have stage 4 metastatic ovarian cancer. There is no stage 5. Oh, and I have to be very tough. The attention was flattering for the first 5 minutes.
Name?
My name. Vivian Baring.
Huh?
Baring. B-E-A-R-I-N-G. Vivian, V-I-V-I-A-N.
Doctor?
Yes, I have a PhD.
You're a doctor?
Oh, Dr. Harvey Kalikian. I am a doctor of philosophy.
Take a deep breath and hold it. Okay.
A scholar of 17th century poetry.
Arms above your head and hold it. Okay.
I have made an immeasurable contribution to the discipline of English literature. I am, in short, a force.
Okay, that's it.
Name?
Lucy, Countess of Bedford.
I don't see it here.
My name is Vivian Baring, B-E-A-R-I-N-G. Dr. Kalikian is my doctor.
Okay. Lie down.
After an astounding undergraduate career, I studied for 3 years with Professor E.M. Ashford, during which time I learned by instruction and example what it means to be a scholar of distinction. As her research fellow, my principal task was the alphabetizing of index cards for Ashford's monumental critical edition of Donne's Devotions upon Emergent Occasions. I am thanked, in the preface, Miss Vivian Baring, for her able assistance.
Thank you. Where's your wheelchair?
I do not know. I was busy just now.
Well, how you gonna get out of here?
I could walk.
It's not permitted.
Well, I do not know. Perhaps you would like me to stay.
I guess I gotta go find you a chair.
Don't inconvenience yourself on my behalf.
It's a 2cc drip. You want to increase that?
Sure, yeah, make it 4.
Miss Baring, this is Jason Posner. He's going to do your medical history and ask you a few questions. He's Dr. Kalikian's fellow.
Professor Baring, I'm Dr. Posner, clinical fellow at the medical oncology branch, working with Dr. Kalikian. Sit over here, please. Professor Baring, I was a student at the university. I took your course in 17th century poetry.
Did you?
Yes, I thought it was excellent.
Well, thank you. Were you an English major?
No, biochemistry. But you can't get into med school unless you're well-rounded. And I made a bet with myself that I could get an A in the 3 hardest courses on campus.
How'd you do, Jace?
Success.
Really?
A minus. It was a very tough course. Yeah, I'll call you.
Okay.
Wheel this over. Okay, now, I'm going to be taking your history, which is a medical interview, and then I give you an exam.
I believe Dr. Kalikian has already done that.
Well, I know, but Dr. Kalikian wanted me to do one, too.
Very well.
Okay, let's just get started. How are you feeling today?
Fine, thank you.
Excellent. And how's your general health?
Fine.
Good. Now, we know that you're an academic,
Yes, we've established that.
so we don't need to talk about your interesting work.
No.
How old are you?
48.
Are you married?
No.
Are your parents living?
No.
How and when did they die?
My father, suddenly, of a heart attack when I was 21. My mother, slowly, when I was 41 and 42, of cancer, breast cancer.
Cancer.
Yeah, breast cancer.
I see. Any siblings?
No.
Now I'm going to ask you about your past medical history. Have you ever been hospitalized?
Yes, I had my tonsils out when I was 8.
Have you ever been pregnant?
No.
Heart murmurs?
No.
High blood pressure?
No.
Venereal diseases? Uterine infections?
No.
Thyroid? Diabetes? Cancer?
No. Well, cancer, yes.
Well, when?
Now.
Well, not including now.
In that case, no.
Okay. Clinical depression, nervous breakdown, suicide attempts.
No.
Do you smoke?
No.
Ethanol.
I beg your pardon.
Alcohol.
Oh, ethanol. Yes, I drink wine.
How much? How often?
A glass with dinner occasionally, and perhaps scotch every now and then.
Do you use any substances?
Such as?
Marijuana, cocaine, crack cocaine, PCP, ecstasy, poppers.
No.
Do you drink caffeinated beverages?
Oh, yes.
Which ones?
Coffee, a few cups a day.
Okay. How many?
2 to 6. But I really don't think that's immoderate.
How often do you undergo routine medical checkups?
Well, not as often as I should probably, but I felt fine. I really have.
So the answer is...
Every 3 to 5 years.
What do you do for exercise?
Pace.
Are you having sexual relations?
Not at the moment.
Are you pre- or post-menopausal?
Post.
When did your period stop?
About 2 years ago.
Okay. When did you first notice your present complaint?
This time now.
Yes.
Oh, well, about 4 months ago I felt a pain in my stomach, in my abdomen, like a cramp, but not the same.
How did it feel?
Like a cramp.
But not the same.
Duller and stronger. I can't describe it.
What happened next?
Well, I don't know. I started noticing my body, little things. I would be teaching and feel a sharp pain.
What kind of pain?
Sharp and sudden. Then it would go away. Or I would be tired, exhausted. I was working on a major project, the article on John Donne for the Oxford Encyclopedia of English Literature. It was a great honour, but I had a very strict deadline.
So would you say you were under stress?
It wasn't so much more stress than usual. I just couldn't withstand it this time. I don't know. So I went to see Dr. Chin, my gynaecologist, after I'd turned in the article, and explained all this. She examined me and sent me to Jefferson, the internist, who sent me to Kalikian because he thought I might have a tumour.
And that's it?
Till now.
That's very interesting. Well, I guess we'll start the exam. Why don't you just sort of lie back and relax. Won't take a minute. Let me get the sheet here. Okay. Okay. Oh yeah. Feet in the stirrups here. Okay. Okay. Could you just, yeah. There. Okay. Good, okay. Okay. Oh, I've got to go get Susie. I got to have a girl here, some crazy clinical rule. Don't move, I'll be right back. Susie? Has anybody seen Susie?
One short sleep past, we wake eternally, and death shall be no more, comma, death thou shalt die.
Okay, here's everything. Okay.
What is this? Why did you leave her like
I had
this?
to find you now. Come on. We're ready, Professor Barry. Get this on. All right. All right. Just get this up. Ooh, just relax. Okay. Isn't that interesting, Susie, that I had Professor Baring?
Yeah. You know, I wish I had taken some literature. I don't know anything about poetry.
Professor Baring was very highly regarded on campus, looked very good on my transcript that I'd taken her course. They even asked me about it in my interview to medical school. Jesus.
What?
What?
Yeah, I survived Baring's course, and no problem. Yeah, John Donne, those metaphysical poets, that metaphysical wit. Hardest poetry in the English department. I'd like to see them try biochemistry. Okay. We're almost done. All right. Yeah, okay. That's it. We're done. Okay, I gotta go. Take her feet out of... Yeah.
That was hard. Now, watch this. I have to ring the bell.
How you doing, Miss Baring? You having some nausea?
Yes.
Okay, I'll be with you in a second.
Someone has to come and measure this emesis and record it on a chart of my intake and output. This counts as output. It's about 300 cc's.
Is that all?
It was very hard work.
Yep, it's 300. Good guess. Okay. Anything else I can get you? Got some Jell-O or something?
Thank you, no.
You okay all by yourself in here?
Yes.
You're not having a lot of visitors, are you?
None, to be precise.
I didn't think so. Is there somebody you want me to call or something?
That won't be necessary. I don't want visitors.
Okay. Well, I'll tell you what. I'll just pop my head in every once in a while to see how you're doing. Make sure you're okay. If you need anything, you just ring.
Thank you.
Okay. You just call.
Do not forget that you are seeing the most interesting aspects of my tenure as an inpatient receiving experimental chemotherapy for advanced metastatic ovarian cancer. But as I am a scholar, I feel obliged to document what it is like here most of the time between the dramatic climaxes. In truth, it is like this. You cannot imagine how time can be so still. It hangs. It weighs. And yet there is so little of it. It goes so slowly. All right, all right. Let's say it's Friday morning. Grand rounds is what they call it. Action!
Dr. Baring?
Dr. Kalikian.
Professor Baring, how are you feeling today?
Fine.
Great, just great. Very late detection, stage just 4 upon admission. Hexamethylphosphosol with vinplatin to potentiate. Hex at 300 milligram per meter squared, Vin at 100. Today is cycle 4, day 3. All cycles are at the full dose. Primary site is here, behind the left ovary. Metastases are suspected in the peritoneal cavity, mainly in this area here. Full lymphatic involvement. At the time of first look surgery, a significant part of the tumor was debulked, mainly in this area here. Left, right ovaries, fallopian tubes, uterus, all out. Evidence of primary site shrinkage. Shrinking in metastases has not been documented. Primary mass, frankly palpable in pelvic exam, all through here.
Excellent command of details. Okay. Problem areas with X and Vin?
First, of course, is myelosuppression, a lowering of blood cell counts. That goes without saying. With this combination of agents, nephrotoxicity will be next.
Anybody else? Side effects?
Nausea, vomiting.
Jason?
Routine.
Pain while urinating.
Routine.
Psychological depression.
No way.
Oh, anything else? Other complaints with Hex and Vin? Come on.
Mouth sores?
Not yet.
Skin rash?
No.
Why do we waste our time, Dr. Berry?
I do not know, Dr. Kalikian.
Use your eyes. Good grief. Hair loss.
Come on.
Doesn't count. You can see that.
Jason?
Hair loss after first cycle of treatment.
That's better. Dr. Berry, full dose. Good. Excellent. Keep pushing the fluids. Jason, clinical.
Oh, right. Thank you, Professor Brown. You've been very cooperative.
Sparing? Is that you beeping at 4 o'clock in the morning? Did that wake you? Sorry, it just gets occluded sometimes.
Oh, I was awake.
Where? What's the trouble, sweetheart?
Oh, I don't know.
Can't sleep?
No, I just keep thinking.
If you do that too much, you can get kind of confused.
I know. I can't seem to figure things out. I'm in a quandary. Having these doubts.
Well, what you're doing is very hard.
Hard things are what I like best.
No, but it's not the same. It's like it's out of control, isn't it?
I'm scared.
Of course you are.
I want to. I don't feel so sure of myself anymore.
And you used to feel sure, didn't you?
Yes, I used to feel sure.
Oh, Vivian, it's okay. It's all right. And it hurts. I know. It's all right. It's all right. It's okay. It's all right. Vivian, it's okay. It's all right. Hey, Vivian. You want a popsicle?
Yes, please.
Okay. I'm gonna go get one. I'll be right back, okay?
The epithelial cells in my GI tract have been killed by the chemo. The cold popsicle feels good. It's something I can digest, and it helps keep me hydrated. For your information.
There you go.
Thank you.
Here.
Sure? Thanks.
Cute.
You know, when I was a kid, we used to get these from a truck. The man would come around and he'd ring his bell and we'd all go running over. And then we'd sit on the curb and eat our popsicles. It's pretty profound, huh?
Sounds nice.
Vivian, there's something we need to talk about. That you need to think about.
My cancer's not being cured, is it? They never expected it to be, did they?
Well, they thought the drugs would make the tumor get smaller. And it has. It's gotten a lot smaller. But the problem is it started in other places, too. And, I mean, they've learned a lot for their research, and it was the best thing they had to give you. It was the strongest drugs. It's just that there really isn't a good cure for what you have yet. For advanced ovarian. I'm sorry, they should have explained this to you.
I knew.
You did?
I read between the lines.
What you need to think about is your code status. What you want them to do if your heart stops beating.
Well?
Well, you can be full code, which means that if your heart stops, we'll call a code blue, and the code team will come in and resuscitate you and take you to intensive care until you stabilize. Or you can be do not resuscitate, which means that if your heart stops, we'll just let it. You'll be DNR. And you can think about it, but I just wanted to present you with both choices before Kalikian and Jason come in and talk to you.
You don't agree about this?
They like to save lives. So anything's okay as long as the life continues. Doesn't matter if you're hooked up to 1 million machines. Kalikian's a great researcher, he is, and the fellows like Jason, they're really smart. And it's an honor for them to be working with him. They always want to know more things.
I always want to know more things. I'm a scholar. Or I was. When I had shoes. When I had eyebrows.
Okay, well, that's fine. I mean, you'll be full code.
No. Don't complicate the matter.
No, really, it's fine. It's up to you.
Just let it stop.
Really?
Yes.
So if your heart stops beating...
Just let it stop.
You sure?
Yes.
Okay. Okay, I'll get Kalikian to give the order, and then...
Susie.
Yeah?
You're still going to take care of me, aren't you?
Of course I am. Don't you worry, sweetheart.
Yeah, she was a great scholar. She wrote tons of books, articles. She was the head of everything. People used to hug the walls when she passed. $275, $520. Let's up the hydration. She won't be drinking anymore. See if we can keep her kidneys from fading. Yeah, I have a lot of respect for her. Just more than I can say for the entire biochemistry department.
What do you want, dextrose?
Keep her saline. She gave a hell of a lecture. No notes. Not a word out of place. It was pretty impressive. A lot of students hated her, though.
Why?
Well, she wasn't exactly a cupcake.
She hasn't exactly been a cupcake here either. Now, Miss Baring, Jason and I are here. We're going to insert a catheter to collect your urine. It's not going to hurt, so don't you worry.
Like she can hear you.
It's just nice to do.
8 cycles of Hex and Ben at the full dose. Kleekian didn't think it was possible. I wish they could all get through it at full throttle. Then we could really have some data.
It's not what I imagined, you know? I thought someone who studied poetry would be more dreamy.
Not the way she did it. Her course is more like boot camp than English class. This guy, John Dunn, was incredibly intense. Like your whole brain had to be in knots before you could get it.
Well, he made it hard on purpose?
Well, it has to do with the subject matter. The holy sonnets we worked on most, they were mainly about salvation anxiety. That's a term I made up in one of my papers, salvation anxiety, but I think it fits pretty well. You're this brilliant guy. I mean, brilliant. This guy makes Shakespeare sound like a Hallmark card. And you know you're a sinner. And there's this whole promise of salvation, the whole religious thing, but you just can't deal with it.
Well, how come?
Because it doesn't stand up to scrutiny. But you can't face life without it either, so you write these screwed-up sonnets. Like a game to make the puzzle so complicated.
What happens in the end?
The end of what?
To John Dunn. Does he ever get it?
Get what?
His salvation anxiety. Does he ever understand?
Oh, no way. The puzzle takes over. You're not even trying to solve it anymore. Fascinating, really. Like, great training for lab research, looking at things at increasing levels of complexity.
Well, until what?
What do you mean?
Well, what happens in the end? Do you ever get to solve the puzzle?
Nah. When it comes down to it, research is just trying to quantify the complications of the puzzle.
You help people, and you save lives and stuff.
Well, sure, I save a guy's life, and the poor slob goes out and gets hit by a bus.
Yeah, I guess so. I just don't think about it that way. As you can tell, I never took a course in poetry.
Well, if there's one thing we learned in 17th century poetry, you can forget all about that, all that sentimental stuff. Enzyme kinetics was more poetic than Baring's class. Besides, you can't just go around thinking about all that meaning of life garbage all the time. You just go nuts.
Do you believe in it?
Believe in what?
I don't know, the meaning of life garbage.
What do they teach you at nursing school? She's out of it. Shouldn't be too long. You done here?
Yeah, I'll just tidy up.
See ya.
Bye, Chase. What are you doing?
The goddamn code.
She's
Get over
DNR.
here. She's research.
She's no code. Jason, she's no code. Kalikian put the order in. You were right there. You saw it yourself. God, the code. 575. Cancel code, room 707. Sue Monahan, primary nurse. No, Dr. Posner's... No.
I got it. I got it.
No.
Get out of the way.
The
Have the
patient
staff
is no
move out.
code. She's DNR.
Let's go. Let's move it.
The patient is DNR.
Okay, unit staff, clear.
Listen.
Back
She's
away
do
from the
not
bed.
resuscitate.
Put the
The
machine
patient
on. Let's
is
go.
The
patient
There's
is
no pulse. No
code.
pulse.
The
Get
patient
that
is
board
no
under.
code.
Let's roll it. Hey, get the board
Wait,
under. Doctor.
stop it.
She's charging.
Listen
Give her
to
1
me.
milligram of
The
ethanol.
orders give back.
Keep
Dr.
it going.
Clicking,
Bicarbonate.
do
1
not
milligram heavy.
resuscitate.
Stop.
Do not
Bicarbonate.
resuscitate.
She's no code. Move out the way. Go.
Stop
Your shot.
it.
Still no reading. No pulse. Hey,
Clear.
Hey,
Come
listen.
along.
I made a mistake.
No code. The patient is no code.
Who the hell are you?
I'm Sue Monahan. I'm the primary nurse.
Let me see the goddamn chart.
The patient is no code. Just get away from her.
Do not resuscitate. Kalikian. The order was put in yesterday. It's a doctor screw up.
What is he, a resident?
Got us up here on a DNR.
Call the code and a no code.